Good afternoon, everyone. My PhD topic is about the effects of tobacco products on oral tissues, and I would like to present my 3 months progress. So, my name is Orsolya Vámos. I am a PhD student and a second-year resident at the Department of Prosthodontics at Semmelweis University. My vision is to spread awareness of the harmful effect of tobacco products, and I would like to promote prevention and cessation. And to achieve this, my mission is to make a comparison on the effects of traditional and alternative tobacco products. So here you can see a list of my specific goals. I am currently working on 2 meta-analyses. I started the first one in September and the second one in December. So let's move on to my first topic, which is investigating the effect of tobacco products on peri-implant tissues. Peri-implant diseases are defined as inflammatory lesions of the surrounding peri-implant tissues. Peri-implant mucositis involves only the mucosa, while peri-implantitis involves both the mucosa and the underlying bone structure, and this can result in loss in osseointegration. If these are not treated properly, patients can lose implants. Smoking is one of the main risk factors of peri-implant diseases, and its role have been numerously investigated in studies. And also, generally, people know that smoking can be harmful for their teeth and implants. But there are newly appeared alternative tobacco products on the market, for example, electronic cigarettes, water pipe and smokeless tobacco, and they are gaining more and more popularity. And people tend to think that these can be a healthier alternative to smoking. So if you want to assess peri-implant health status, we can use peri-apical radiographs to measure the peri-implant bone loss. Also, we can use a periodontal probe to measure the clinical parameters like probing pocket depth, bleeding on probing, and plaque index. And for the immunological assessment, we can use a paper strip to take a sample of the peri-implant cervicular fluid, and then we can quantify the levels of pro-inflammatory cytokines, for example, tumor necrosis factor alpha and interleukin-1 beta, because they play a role in the peri-implant tissue destruction. So our aim is to investigate the clinical, radiographic, and immunological peri-implant parameters in different types of tobacco product users compared to non-smokers. For the clinical question, we want to know if there is a difference in a peri-implant health status of different types of tobacco product users compared to non-smokers. We have a PECO framework here. The population are patients with dental implants. We have 4 types of exposures, the 4 types of tobacco products, and we want to compare them to non-smokers. Our primary outcome is the peri-implant crestal bone loss in millimeter, and the secondary outcome are the clinical and immunological parameters. For the hypothesis, we think that the different types of tobacco product users have worse clinical, radiographic, and immunological peri-implant parameters compared to non-smokers. And why is this topic important? Because I have mentioned before that smoking is one of the main risk factors of peri-implantitis, and with this comparison, we want to make valuable education material for community dentistry, so we want to know which type of tobacco product is worse. My systematic search was conducted in 4 databases in this November. And as you can see, I am done with this full text selection, and now I am doing the data extraction. Here you can see the flow chart of my selection. At first, I had more than 10,000 articles, but after the title abstract selection and the full text selection, I have 46 eligible articles. So let's move on to my second topic, which is the impact of smoking status and electronic cigarette use on non-surgical periodontal therapy. So periodontal disease are common oral infection Gingivitis is characterized with red, swollen gums and bleeding, and if this is not treated, it can progress to periodontitis, which can result in a loss in the supporting bone. So severe periodontitis is actually the 11th most prevalent condition in the world, with a prevalence ranging from 20 to 50%, and it is the major cause of tooth loss. So the goal of periodontal therapy is to preserve, improve, and maintain the natural dentition. Subgingival debridement can be an effective treatment in reducing probing pocket depth and improving the clinical attachment level. But there are actually some factors which can have an influence on the success. For example, smoking, and as I have mentioned before, there are newly appeared tobacco products, for example, electronic cigarette, which needs to be investigated. So our aim is to investigate the effect of traditional and electronic cigarette use on clinical outcomes of non-surgical periodontal therapy compared to non-smokers. For the clinical question, we want to know, does smoking have a negative effect on clinical outcomes of non-surgical periodontal therapy? We have used a prognostic framework here. So the population are patients with periodontitis undergoing non-surgical periodontal therapy. The prognostic factor is smoking, either traditional or electronic cigarette, and the outcomes are the clinical parameters. For the hypothesis, we think that smoking has a negative effect on clinical outcomes of non-surgical periodontal therapy compared to non-smokers. And again, this topic is important because smoking is a known risk factor of periodontitis, and we want to create an educational material with this comparison. So here you can see an overview of my projects. I want to finalize my first meta-analysis until May and the second one until September. Thank you for your attention. I want to say goodbye with a quote by Nielsen. Successful people are not gifted, they just work hard, then succeed on purpose.
I would like to ask that, as far as I know, many people smoke more than one type of tobacco products. Do you plan to exclude them, or is there a way to include them in the study?
Yeah, thank you. Very good question. So actually, in these studies, they always have a questionnaire that which type of tobacco product they use, and they have data about the smoking habits. And in most studies, dual users are excluded. So that means that if someone smokes electronic cigarette and traditional cigarette, these are excluded.
Thank you very much for your presentation. My question would be, what are you doing in regards of also again the dosage and length of smoking then? Because some people do smoke a pack, some much less. So how do you do this?
Thank you for your question. So as I have mentioned in the questionnaire in the beginning, there are data about how often they smoke, and so based on the smoking frequency, if there will be enough data, we plan to do a subgroup analysis maybe.
What are some possible confounding factors that you might have from the exposure, from your population, that you think could affect your outcomes?
So I didn't mention, but in the population we have an exclusion and inclusion and exclusion criteria. So we want to examine healthy patients. That means that these patients are not suffering from any systemic diseases, for example, diabetes or hypertension, because this may be a confounding factor. And also patients with diagnosed periodontitis, I mean, in the first topic, are excluded. So that's how we want to deal with the confounding factors.
Do you also plan on doing subgroup analysis for different products? As I was thinking now, I assume there are also many different products, for example, for e-cigarettes. Some you look like huge batteries or the small ones. So I think there could also be a difference in clinical outcomes from them.
Yeah, so actually we want to do a network meta-analysis based on the different types of tobacco products, and based on the traditional cigarette smoking frequency, I have found in the articles that they differentiate the different levels of smoking, so light smokers or moderate smokers. And for the other type of products, they do not really differentiate them. So actually there are more types of electronic cigarettes, like there are 4 or 5 generations, but there is no data about which kind. And also in the liquid, so which kind of liquid they use, there can be a difference. So this is a limitation of this study.